everyone, this is Victor from Cyborg for Life, and in today's special interview, we're continuing our Surgeons on Stride series as I'm joined by both Dr. Janet Conway and Dr. Michael Assayag from the International Center for Lengthening at Sinai Hospital in Baltimore, Maryland. Now, both of these limb lengthening surgeons are going to share their perspective of the current state of the Precice-STRYDE intramedullary lengthening nail, as well as give consoling words of advice to their current and prospective patients. And so, please enjoy the interview with Dr. Conway and Dr. Assayag. Hey everyone, this is Victor from Cyborg for Life, and today I'm joined by the Queen of Limb Lengthening, Dr. Janet Conway, and Dr. Michael Assayag from Height RX, both at the International Center for Limb Lengthening at Sinai Hospital in Baltimore, Maryland. Hey, Dr. Conway. Hey, Michael Assayag. How are you doing today?
Good, Victor.
We're doing great. Thank you for having us.
You got it. Thank you for joining me. Thank you both for coming back onto the show. So today I want to talk about the recent removal of the STRYDE nail, the intramedullary lengthening nail. And basically, NuVasive has pulled the nail off the market due to wanting to do more testing for the nail. So several patients have been in a frenzy as of late regarding the recent removal and other BioDur devices. So I wanted to get you guys' take on what you think sparked this voluntary action from the biotech company.
Oh, well, I think there's been some studies in Europe. I think the European market was the first one to sort of see that there was some x-ray changes. And so I think that they got concerned. Some of the surgeons got concerned about this, and then they elected to stop using it. And I think NuVasive pulled it in Europe. Mm-hmm. And then I think that was the impetus to start to consider doing the voluntary recall in the United States. So, I think that's really what happened.
Okay.
So for the patients out there who are not necessarily aware of the situation, I know I've posted on the limb lengthening forums about the topic, and I've described my take on the topic. Mm-hmm. And what happened, just like Dr. Conway is saying, is there's a surgeon in the UK who found out in his patients that a high proportion had some radiographic changes.
Okay.
Different type of changes with the STRYDE nail. Without necessarily any clinical significance, but it prompted him to wonder what causes it. And upon removal of the nail, what he found is that there was corrosion or rust mm-hmm. At the junction between the male and the female portion of the nail. Mm-hmm. What it created is that the MHRA, which is the UK version of the FDA, mm-hmm. Got wind of it and wanted to have answers. So they took all the NuVasive implants off the market.
Okay.
Now, that included as well the Precice nail, which is made out of titanium, right? In the US, NuVasive wanted to do its due diligence and decided to bring up to speed the FDA and basically voluntarily disclose what was happening, and reached out to the key surgeons to basically reevaluate their cases, which we did here as well, and we're taking this very seriously. So it's a radiographic finding mm-hmm. that seems to be correlated to maybe corrosion of the implant, but there's not a lot of answers yet. Mm-hmm. Basically NuVasive is just voluntarily reviewing the topic and taking it seriously. Know that our pediatric partners have removed a lot of STRYDE nails already. They did find corrosion at the male-female junction. I think another surgeon who we did an interview with mm-hmm. Already showed some pictures of what it looks like. Yeah. And what it looks like is at the junction between the male and the female junction, mm-hmm. that's the area where the nail comes out and telescopes.
Right.
And basically that's two pieces of metal that are in contact.
Okay.
And when two pieces of metal are in contact, mm-hmm. it can cause corrosion. Typically it will happen when it's two metals that are of different material, different types of stainless. Right. However, as the nail telescopes, it creates little scratches through the surface. Mm-hmm. And really, Dr. Conway can stop me if I'm wrong, but what really makes stainless is a layer of chromium oxide, which is basically chromium mm-hmm. on the implant. But if that layer is broken down, and especially in the body, which is a big vat of salt water, right? where it creates a big chemical reaction.
Right.
And we've seen that in other implants. And once again, that's something I wrote on the limb lengthening forums. Hip replacements create corrosion.
There's a name for it. They're called trunionosis. I mean, there's yeah. So I mean, it's a common problem with implants, like with mismatched metals and things. And say you want to put titanium screws in a stainless steel plate. I mean, it just happens. And so I always consider it like the cost of doing business, so to speak. Like, you're using it as a tool.
Right.
We'll keep on.
So basically, to come back to that, they found what our partners have found, and what we found is that there is corrosion at that area where scratches may happen, where bodily fluids are pumped and creates an exchange in ions. And what happens when ions are exchanged between metals, it creates a more stable form of metal. Or rust, that we call corrosion. Now, it's not the only implant that does that. I know we're not the only ones to say that, because it's true, right? It's something we learn in our orthopedic training, the science of materials. So right now, there's a, as you mentioned, there's a frenzy, there's a fear about that, but that's nothing that is new to the world of orthopedics.
And what I'm going to say too, Victor, is might have been privy already to some of the documentation and information from the European study where they evaluate things. And these X-ray changes people are like worried about, but all the patients in their study actually achieved their limb length. Did its job, and so the X-ray changes resolved when they took the rod out. And so I always think about it as, it's a device, it's a tool. And just like when you use the external fixator, you sort of the cost of doing business with an X-Fix is like the pin tract infections. There's a 10% risk of pin tract infection if you're going to lengthen with an external fixator. And so, when we use the different tool, like the ISKD, some of the things we would accept sometimes are that the nail would lengthen too quickly. And that's sort of the downside of that, implants, but we were able to use it effectively and avoid problems with certain, like a knee mobilizer things. You kind of work around the little nuances of each device. And I think, the same thing with the Stride. I think, we have a lot of these in, and our patients are in their desired length, they're making good regenerate. And some of these X-ray changes really aren't of tremendous clinical significance. And always tell our patients, like when I put a magnetic rod in, I tell them, at some point in your life, you may want to get an MRI, and to just not have it be a hassle for you. We always say, hey, get everything out of the ear. Your bone will be enough, and you just want to go in and get it out. And so I don't think it's a problem with failure of the implant. I don't think it's a problem with it not doing its job. I think that it's something for us to be aware of. And so, paying close attention to it and just using it for when we need it, and then just get done with it. And I appreciate the company addressing the problem just so that, they want to make sure that it stays on the market, and all these, it's as great as it can be. I appreciate that.
Right.
Now, you may wonder what reactions happen, right? Dr. Conway mentioned reactions that we've seen. So we've seen basically three types of reaction. One that is basically the bone at the junction and towards the telescoping part that thickens, that creates layers of protection. And that's usually a defense mechanism that the body uses to strengthen the bone. So it just means that it's reacting to something. That's one. The second type of reaction that we've seen is some inflammatory reaction inside of the canal that creates a hole in the bone, basically as if the body is defending against something. That's a reaction that's commonly seen in hip replacements. When there's plastic wear from movement, the white blood cells go and eat those little pieces of plastic, but that creates an inflammatory response that can gnaw away at the bone.
Okay.
And that's called osteolysis.
I
It's like
see.
a term for like, it looks like a little chunk out of the bone. Well, I don't know, like a
Shark bite.
shark bite,
A
a little
shark.
shark. Yeah. And so, and then the other thing that Michael was mentioning, the reaction on the outside of the bone, we actually call that like a periosteal reaction.
Okay.
These are things that, the bone's responding to the implant, and so there are fancy names for it, but
So we've reviewed about 60 cases, and that's basically what we found. And anywhere between 50 and 60% of the time, one of these reactions happen. Oftentimes asymptomatic, meaning they don't create any symptoms.
Okay.
Sometimes create a little bit of pain.
Mm-hmm.
And what we've noticed as well is they occur anywhere between 6 and 12 months. So they don't occur during the lengthening. They occur when basically the lengthening has stopped.
Mm-hmm.
That male and female junction
Mm-hmm.
stay in contact for a while together.
Okay.
It has time most likely to create corrosion.
I see.
Now, another thing that our partners have done,
Mm-hmm.
I wish they were here today to discuss a little bit about that, but they've taken biopsies of the bone and of the soft tissues around the reaction. And I think that's the interesting part of this, because it confirms the fact that in the white blood cells, there are pieces not only of metal,
Mm-hmm.
but there are pieces of other materials that can be in the nail, such as silicone.
Mm.
So there, it's definitely an inflammatory response
Okay.
to something, whether it's corrosion, whether it's silicone, a little bit of both. We know that silicone with metal can create corrosion as well. So right now, everything tends to point in the same direction.
Okay.
Another thing that we see is that these bone reactions tend to heal as well, even when the rod is still inside. It consolidates, it becomes mature, and it's basically stops evolving.
Okay.
And when the nails are removed, the more severe completely disappear. So basically, that's really the state of what's happening right now.
Okay.
With those BioDure, with that type of stainless steel
Mm-hmm.
implants.
I see. And so for patients who have the nails, both of you have patients who've had these nails inside them, should they be worried? Should they rush to get their nails removed?
Well, I think Michael and I are, we talk to all our patients about it and
Okay.
let them go on. And then we also send our patients for cobalt and chrome levels,
Okay.
just to be really just obsessive about the whole thing and just on. And honestly, the ones I've gotten back have been very mildly elevated. And when I say mild, I mean mildly elevated. Like, and it's just enough to be like, all right, well, maybe there's something going on. It's not stone cold normal, but it's not like crazy levels where you're like, wow, we have to worry about, toxic levels in the blood. It's not that at all. And so I'm not telling my patients to rush to get them out. And, I want to make sure that they fully heal. And, we're still doing lengthenings. We're just using the Precice-2 right now. So even if if there's some patients who are sort of on deck for the STRYDE and they're like, oh man, should I wait? And I'm like, oh, you can still get your lengthening. It's just, it's been done effectively for so long using the, Precice-2 nail that, you're going to get a good result. You're just not going to be able to step on it as much as you like and fully weight bear until this little issue gets resolved. And I'm really sure how long it's going to take for NuVasive to, they always keep us updated. Like they've been giving us some periodic updates about their engineering and their testing. And so I think, they of course don't want to keep it off the market for too long, but I can't imagine it's going to be as long as a year. Have you heard anything different?
Well, so to answer your question, we don't rush in removing the implants because you want to make it safe. And right now, there's no proof that it's negative for people's health. What's happening, right? And we know from other implants that corrosion doesn't kill, corrosion doesn't create tumors, corrosion doesn't, give you any kind of systemic toxicity. As Dr. Conway said, there's normal chromium levels in your body, right? There's chromium in drinking water. So it's normal to have less than 1 nanogram per milliliter of chromium in your body. And what we've seen is elevated up to 1.25, 1.5. While with other type of orthopedic implants, you could see tenfolds that, even more than that, levels that were through the roof. So there's no rush, there's no panic that's necessary right now. We're observing. There's no proof that anything wrong is happening. So basically, the ship keeps the same course. We've been using Precice for cosmetic lengthenings. I have a few planned for the next, for these past weeks, the next couple of weeks, the next month, and Precice is a great implant.
Mm-hmm.
It has an amazing track record.
Mm-hmm.
It has 10 years of track record, 9 to 10 years of track record. 13,000 have been done between all the iterations of Precice. We're not going to call them Precice 1, 2, or 2.2. It's just Precice, right?
It's Precice.
The latest size.
Yeah.
I would always state that I'm driving a Civic 2016. I'm driving a Civic. So Precice is a great implant, creates good bone, but as Dr. Conway said, doesn't allow for as much weight bearing. So it's a trade-off, right? Where it may require a little bit more help than with Stride. So a lot of people were undertaking the Stride lengthening on their own, right? Without help, without outside help. With Precice, it's a little harder to do that.
Yeah.
So you have to make sure that you're set up appropriately.
That's actually what I wanted to ask next, is like kind of comparing the Precice 2 and the Stride, but you already kind of did. But so for patients who are obviously right now during the pandemic, a lot of people are working from home, or, they have more time on their hands. Patients wanted to get this done a lot during the spring, early summer, and be ready for either school in the fall or when work kicks back off or whatever. What do you have to say to your prospective patients, like in terms of like maybe how long it's going to take to recover? Is there like an extra month that they should factor in? Or you said weight bearing capacities, Dr. Conway. What kind of things can you use to kind of console your prospective patient who might want to get this done sooner than wait for the Stride to come back?
Sure. I mean, when we did the regular Precices, I could tell people, like a lot of young people, they want to sort of finish their college semester up. And if we did their lengthening in May, say femoral lengthening, and we did about 6 centimeters, they could be weight bearing as tolerated when they went back to school in September, most likely with or without crutches, maybe one crutch or whatever. But, and so they could get it done over the summer and go back to school and still be in good shape. Wow. And that was Precices, I think the Stride does speed up the rehab because, they're using their muscles more, and they're adjusting quicker. But the Precice wasn't that slow when we used it. And it just really depends. I think the femurs are pretty quick and it's a lot easier, and the tibias are a little bit harder and a little bit slower. But that's what I would tell our patients is just and like Michael said, you're going to need a little bit of help just because. With the non-weight bearing, it's hard to do like food shopping for yourself, or, maybe driving to and from your appointments. I always tell people they need a lengthening buddy. Yeah. So they might need a lengthening buddy for the Precice. But I mean, a lot of our Stride patients were like driving themselves to appointments, drive themselves to PT, going to the grocery store. And so that is a little bit different.
Mm-hmm.
Bring up as well another interesting point, and that's a point of discussion in the Limb Lengthening and Reconstruction Society. Precice creates great bone.
Yes.
An amazing regenerate. Okay. And it's unclear if, because of its rigidity, Stride creates the same bone quality and the same bone density as fast. Not everyone agrees on that, so it's a point of contention, but subjectively, when we look at x-rays, it seems like Precice creates better bone than Stride.
Wow.
I don't know your experience, but cool. In terms of regenerate as it lengthens.
Okay.
So there's a lot of upsides to using Precice. Okay. It's a implant. It works well. If you're petite, if you don't weigh too much, you may be able to bear weight with maximal arm assistance, and within 3, 4, 5 months, be back on your feet.
Wow. That's excellent. Okay, very cool. And then I just want to kind of like a couple more questions here real quick is we mentioned a little bit about NuVasive and how they're handling the issue. Obviously, this was a voluntary recall, as Dr. Assayag mentioned. And they also removed the Precice plate, which I know you guys, implanted there at Sinai. What do you think that how they're handling the removal of the devices to satisfy the regulatory bodies such as the FDA? Do you feel that it was a good call on the part of the company to do this, or should they have just left it on the market and tried to kind of find a workaround? As surgeons, what's your perspective on that?
Well, I think it's in their best interest to sort of jump ahead of the game.
Okay.
Because the last thing I want to do is have the FDA come in and, we're pulling your implant. So I feel like if they voluntarily recall it and do the due diligence of the testing and do the additional tests with the engineers, I think it shows that they're being responsible. And so I'm good with the whole situation. It is inconvenient, because we like the implant and the patients love it.
Yeah.
But I appreciate them being, sort of proactive in getting the whole thing done. I just would like to know when it's going to come back. But, they're always keeping us updated with phone calls. So, I mean, we'll see how it goes, But I think they're doing a good job. I feel like it's appropriate.
Right.
My MO, transparency first.
Yeah.
And being brutally honest is important. There's no sleazy marketing. There's no in my clinic and in Dr. Conway's clinic as well. So I think what they're doing is great. They're doing their due diligence. They're being safer than sorry. They cannot be accused of brushing anything under the rug. They were not asked to do it. They went proactively and did it, at least in the US. So it's they're doing everything they should be doing, and we should actually be happy that they're handling it like that. At the same time, we're not curing cancer, right? We're saving quality of life. We may be saving people's mental health as well, but we're not curing cancer. So we have the luxury not to use that implant. We have other alternatives in the meantime for people who really want it here and now. You asked me a question that I didn't answer. When is it going to come back? Your guess is as good as mine. We hear from official channels that it's anywhere between, it's in Q3 of this year, so July to September. But I know we have partners who are not as optimistic as that. But we'll see. Whenever the time comes, we'll be ready to use it.
Okay. And when it does come back, should patients be hesitant to get it done with the new STRYDE or whatever fix that, the company NuVasive came up with to work around this issue?
Would, explain to any new patient the issues with the implant and that it's been rectified.
Okay.
I don't think that I will be stressed about using it.
Okay.
Whatever workaround or whatever solution they come up with, company has a lot of integrity, and so I would feel like I'm using it as a tool for a short time to get the job done. And it would be great if whatever they did to eliminate the x-ray changes would be nice, and I would just explain to the patients that's what the change was, and it's still a great implant. I feel like I would be comfortable using it again after they've reworked whatever they need to do.
I think patients should be more aware of all the complications and risks of limb lengthening itself than the implant itself. So when it comes back available again, it's not going to be a completely different implant than what we've been using for the past 2 years. It should be reliable. It should be even better.
Okay.
Now, another thing that I always mention is we're defying nature. We're adding people. We're adding height to people who otherwise have no health problems, right? So it's a world of compromise. There's nothing is free, and every implant that you implant in the body interacts with it. As I mentioned, the body is a very alive structure, and it interacts with anything. Right. We think metals are inert, but they do interact with our body. So there's always a risk. However, if you ask us, are you confident about that implant, and would you use it on your family member? For me, the answer is yes.
Okay. You too?
Me too.
Okay.
Yes.
Very cool. That really is a powerful statement right there, because if you're willing to use it on your family member, then that means you feel confident as a surgeon, and your patients should as well. Now, you guys are like, superstars who change people's lives through limb lengthening and deformity correction. You guys have amazing talents. I mean, Dr. Conway, you've changed my life. I know that. And I'm trying to share the knowledge with other people. So thank you for that. And Dr. Assayag, you're doing an amazing job with what you do. So I just want to kind of give you guys the time to give a shout out to your fans out there and your prospective patients and past patients. This is your final words, pretty much. Just kind of go ahead and give them a few words of advice or recommendations. So Dr. Conway, if you want to go ahead and take it first.
Oh, well, sure. Well, thanks, Victor. I really enjoy, like you said, changing patients' lives. Some of the stature lengthening patients are some of the most grateful patients, the most they're a pleasure taking care of them because they want to get better and they're highly motivated, and it's just fun because it's such a dramatic result when you see someone, they come in the office and they might be shorter than me, and when they're walking out, I'm like, hey, you did great. And, it's really fun. It's very encouraging. And so it's very gratifying for me as a surgeon I really appreciate, the impact that I see on the patient's lives. So I love it. I'm happy to keep doing it. I really feel like, there's been so many advances in the last 20 years in limb lengthening that I think things are just going to keep getting better. Like, from the early versions of the telescopic nails to the precise plates, that we're now using. I mean, it's just amazing. So I just really feel like there's such a great opportunity as a surgeon with the innovations and for patients to take advantage of it. So that's my take on the whole thing. Michael?
Awesome. Yeah.
You're too kind with your words, by the way. I don't consider myself a superstar, and I didn't know I had fans. So
You do. You guys have lots of fans.
It's flattering. You don't see it, but I'm blushing underneath it. Quite frankly, we're up, as I said, we're up and running. We're happy to see patients. I have plenty of patients who are undergoing precise lengthening or continuing and who are planned for the next 6 months. I have plenty of patients who decided. I have a growing list of patients who need to be reached out to when STRYDE becomes available again.
Okay.
So the answer is you have to do, and I'm talking to the patient out there, you have to do what is best for yourself. You know your reality. Know what your limitations are. Know what what help is available to you around, and know what your budget is. I mean, Precice represents a significant cost saving as well. So take all of those in consideration and really make the best decision for yourself. We're still going to be, I don't plan on going anywhere. I don't think Dr. Conway plans on going anywhere. So we'll still be there in a year, in 3 months, in 6 months, whenever it comes back. We're also available for malunion deformity correction, knock knee, bow leg deformity correction, osteomyelitis treatment, everything that's considered limb lengthening. Limb lengthening as wide shoulders. We're here. Contact us. We're willing. We love to meet anyone from all around the U.S. and all around the world. And with telehealth, with Zoom, it has never been so easy. So just reach out. We're waiting for you. I can't wait to meet each and every one of you.
Awesome. Well, I'll be sure to post both of you guys' contact information in the show notes. Well, thank you both, Dr. Janet Conway and Dr. Michael Assayag from the International Center for Limb Lengthening at Sinai Hospital in Baltimore, Maryland. Thank you both and have a great day.
Take care, Victor. Thanks so much for having us.
Yeah,
Thank
definitely.
you, champion.
You got it. Wow, what a powerful statement both Dr. Conway and Dr. Assayag said there, that they'd be willing to use the STRYDE nail as is on their own family member. Now, that's not to say that they're not worried or concerned about the current state of things. Quite the contrary. It just goes to show that, based on the data they've collected, that they believe that patient safety can be and has been maintained. Now, they also said that the Precice 2 nail is available for those who want to get lengthening done in the meanwhile as the STRYDE nail is being approved upon. And so if you want to reach out to either Dr. Conway or Dr. Assayag, you can find both of their contact information in the show notes. Until next time, this is Victor from Cyborg for Life, signing out.